Commuting is one of the main contributors to the poor air quality in the country. Parking is very, very limited, which means we've got to find different ways to attract and retain staff. From the scoping data, we found out that there is somebody that commutes from Edinburgh, which could be a challenge, but we also found out the average distance that most staff commute from, and that there is a lot of staff that can find alternative ways to travel rather than single occupancy vehicles.
With travel, it's more about promoting other options to try and influence behaviour change, to try and encourage those more sustainable behaviours. So that might look like things like improving showering facilities so that when you do cycle in, it's a more positive experience and there's less friction in that process.
We've been able to put together things like personal travel plans for staff so that they can find out that there are different ways, they don't have to bring their car.
The Trust are leading on signing a healthy climate prescription, which is something that's been signed by lots of doctors already, but it's sending a message to COP27 and to our government and others about what we as health professionals see needs to be done in terms of climate change.
They've been able to give us our ACEL score, which tells us what our commuter emission levels are, so that we can set targets to achieve what we need to by the time we need to achieve it. Without the personal travel plans that we've been able to link to our car parking policy, we would have been left with just approaching staff face-to-face. Personal travel plans online enables us to reach a lot more staff than what we could do face-to-face.
If we can have apps like Lift Share, for example, which make the process of finding a lift into the hospital easier for that individual, then that's sort of the tactic that we try and use to try and approach sustainable travel.
Mobilityways has helped us to build a business case for sustainable travel. It's helped us with building a business case for a new shuttle bus that's going to be launched later in the year for our hospital in Weston. And it's helped us build a business case for our new on-demand shuttle service that we've launched for staff overnight. So we found that our ACL score pre-pandemic was lower than it is now, which it was good to find that out because it gives us the evidence we need to convince the decision makers that we need to put the alternatives in place so that the way people commute to this hospital is sustainable.